Today, I wanted to have a chat with you all and talk about how Active Health Clinic actually began. And if anything, what happened before Active Health Clinic was around. So I don't think we ever grow up saying, I want to work with fatigue or pain or orthostatic intolerance or what we generally term these days as invisible illnesses. It's something that there are life events and different things that happen that move you in that way. So I did a sports science degree because I like sport and I like science, and ended up specializing in cardiac failure. So that means people with long-term heart problems. And then from there, my first job was actually at the Austin Hospital. And I ran and actually instituted the cardiac failure programs, but also did a lot of other outpatient rehab, which included pulmonary rehab, so respiratory conditions, orthopedic, so hips, backs, knees, general ward work on the wards for surgery. But most importantly, probably one of the biggest turning points was that I was involved in an adolescent inpatient program for chronic fatigue syndrome, or ME. And this, as I sort of reflect, it was a huge piece. I met an amazing pediatrician named Lionel Lubitz, and he instilled a belief in me and a belief in the people that we treated or helped manage. That often what is termed as an illness that was invisible, so you couldn't see it, whether it be made up or psychological or something along those lines, and actually met people where they were and involved putting them into a program that was multidisciplinary, that had a range of different people, that helped people start to put structure and understanding back in their life. Now, by no means was this perfect. We're talking the early 2000s, so about 2001. But it was probably one of the first programs that actually, I think, showed belief, and that people with invisible illnesses or chronic fatigue syndrome need to be heard and believed. And so this started to really inspire me, and I found a love of working with people with ME/CFS because you got to engage, you got to meet, to understand, to know. And I think the hard work, the intelligence, the dedication towards someone working on their health really drew me to them. And I participated and worked in that program for about 3 years. And at that point I decided I needed to travel, or wanted to travel is probably a better word. And so I resigned from that position and left and did a lot of travel around, and I'm blessed to have been to like 40 plus countries and met a lot of different cultures, and I think that taught me a lot about myself. But most importantly, I landed in London and found that they had adult outpatient services that were dedicated towards treating ME/CFS. And so Dr. Gabrielle Murphy is an immunologist who is a huge mentor of mine and a wonderful person. Got me involved in that service and some research in the PACE trial and other things. And that led to me working at the Royal Free Hospital, but also St Bartholomew's, and in Bath, Edinburgh, and also Oxford. So I was able to travel there. That was part of a multidisciplinary team of psychologists, physios or exercise physiologists, and OTs. And it really opened my eyes up. So coming from an adolescent population to an adult population, so inpatient and then outpatient, it really sort of showed me again that this is where I want to be. And I was able to work full time, or actually I worked 4 days a week and traveled 3 when I was there. And I spent, I think, 3 years and had to make the very hard decision whether I wanted to continue and to basically permanently relocate or to come back to Australia. And decided to come back to Australia, and again spent, I think, 6 months traveling overland through Europe, across through India and into Nepal and Thailand, got engaged, and then came back. And when I got back, I basically decided that this is the path for me. This is what I wanted to do, is to make a difference to those that couldn't be heard. Often, we basically wanted to make invisible visible. We wanted people with ME/CFS to be seen. And at that point in time, not a lot was really actually known behind mechanisms. We followed a system, but then also orthostatic intolerance, or POTS, pain, mast cell activation syndromes, central sleep disorders. These are things we didn't necessarily pick up. So over the time, things have evolved immensely. But when I arrived back, I took over the program at the Austin Hospital and ran and developed that, because I gained so much knowledge from the UK and was able to expand and worked in that until it was relocated to the Royal Children's Hospital. And at the same time, I decided that I could help people by seeing them. And that's when the beginnings of Active Health Clinic actually started. So the name Active Health Clinic refers to active, not in a physical sense, but being active or proactive in your own care. Health is important, identifying that it is all about your health. And clinic is, we're taking a medical or an allied health, a scientific and evidence-based approach towards that. So that Active Health Clinic was born in May of 2008. So as of this recording, we're close to turning 15, which is a really proud achievement. So whilst doing that, I had an experience myself, which even further cemented. So not many people know that I actually have an autoimmune condition named sarcoidosis. And sarcoidosis can affect the limbs, so mainly feet, but also hands and the lungs. And I woke up with, as I look at my feet, I woke up with feet size of kids' footballs. They were huge, and I couldn't walk for more than a metre or 2 metres. It felt like my feet were splitting apart or someone was stabbing daggers into that. Not that I felt that, but it's the feeling, the thing that most came to me. I had some trouble with my breathing. I had extreme fatigue and feeling hot and cold, a lot of dysautonomia, and didn't know what was going on. And so I went on to high-dose steroids it ended up being close to 2 years, 1.5 years, 2 years, because every time I came off those steroids, I'd have a repeat of this condition. Now, thankfully, I've got that under control, and it's not a limiting factor for me day to day, but it's important that I manage myself. I have to pace, I have to do a lot of different things to maintain my health and exercise sustainably and other things, while also looking after a family too. So I think that really cemented the need for this, because it gave me a taste. Now, I was fortunate in some ways that there was a blood measure, and I was able to take some high-dose prednisolone, which did help, which also had some side effects, but I was able to sort of get through that. And I think at that time, because I had to cease work and I couldn't look after people, that it made me realize that I couldn't do this alone. I had to have a team behind me, and bringing people from different disciplines and expertise into this, as well as individuals. So that's when Active Health Clinic really started to become multidisciplinary. So over the period of time, we've had psychologists, and we have a dietetic service. And so the development of this is really important. And this is something that isn't finished either. This is something that we would love to expand out to have basically a service where everyone's needs are met. They feel believed, trusted, and part of a community as well. So we started in Kew with 1.5 rooms and have now, in 2011, I think it was, we moved to Blackburn where we had 4 rooms, and we had a psychologist, 3 exercise physiologists, and then in 2018, we moved to our current premises, which has 9 rooms, a movement space, an education space, some sensory rooms, for recovery rooms, a reception that is quiet. Even though there are some stairs at the front, we have a lift, we have disabled parking and access. So something that is just more tailored and built for people with invisible illnesses. So over that time, we've grown, from myself, we now have over 20 team members, and we've built the communities like the Active Health Clinic Connection, the AHC Connection, through our socials, our YouTube channel. And at the beginning of 2020, we set a goal to impact 1 million people by 2022, and we did achieve that. And that's something that I'm super proud of, because the more that people hear about these conditions, then the less invisible that they are. You know, I know someone with, or I'm, you know, I see you. I think it's probably one of my favorite sayings at the moment. You know, for people to be met where they are and not to be doubted, but to be believed. Now, I understand that people will hear different things. Oh, have you tried this and that? But we want to really make sure that, you know, people get appropriate care and that it's mainstream. So over this time, you know, the clinic's been involved with research. So we have ran studies on compression leggings and orthostatic intolerance, and also lecture at master's level. You know, we've done many different podcasts, been on TV, radio, and all these things are to increase that awareness and visibility of invisible illnesses. And like I mentioned before, it's something that now we know a lot more. We're not just using a system to work with people, we're actually working through the why it works, you know, the why someone is unwell. So the physiology that goes deeper into MCAS, but as well as the Olympic rings or concentric circles of other conditions like orthostatic intolerance, PASC, mast cell activation syndrome, central sleep disorders, you know, pain sensitization, or, you know, or chronic pain as it's often referred to. These are things that we see, and I keep going, like Ehlers-Danlos syndrome and hypermobility. There's so much, and they overlap. And you know, I'm proud to have a team that, you know, continuing to put research into this, and every team member has, you know, hours per week to develop, to come back to the team, so that each and every single year we are better at what we do. And there's that striving to make what we know better, but also the experience of people, you know, whether it be an individual, a family, a community member. You know, we are just dedicated to, you know, making this visible. And a large chunk of the team have these illnesses. Yeah, and for me, and I've said a lot through this, and I'm really proud, but I am really proud that we provide opportunities to those, you know, with invisible illnesses, you know, to see them, to meet them where they are, and basically, yeah, allow them to help other people. So our next goal is to impact 26 million people by 2026. And I know that by watching this, you're already part of that journey. But there are many chapters to come. You know, and I thank you and the impact that you have, you know, your dedication towards this, because without all of you, we're not anything. So hopefully you've enjoyed or learned something from this journey about who we are and what we do. And if you have any questions, then we'd always love to hear from you. Thank you.